This is Sarah Sorum, Vice President of Professional and Educational Affairs for the Pharmacy Society of Wisconsin. This webinar will walk you through the implementation steps for Wisconsin's statewide Naloxone standing order. Before I begin, I'd like to acknowledge the student pharmacists that contributed to the development of this webinar program, as well as a number of PSW staff members. This program is only made possible through the collaboration we've had with the Wisconsin Department of Health Services and the team there that has worked to develop the Wisconsin statewide standing order for naloxone. I want to particularly acknowledge Lisa Bullhard-Cawthorn, Jennifer Tramner, and Dr. Jonathan Myman. And certainly we have many members that have already taken up the charge to implement a naloxone standing order in their practices, whether that be through an individual medical director or other physician relationship, or through the new statewide standing order. This webinar is designed to provide those that have not yet implemented the standing order the opportunity to do so. There are no disclosures to report. This program is available for CE, and there will be instructions provided on the website in order for you to claim CE credit for this program. During this webinar, we'll discuss the prevalence of the opioid overdose epidemic, identify the role that naloxone has in the prevention of opioid overdose death, identify risk factors that may indicate a patient would benefit from having naloxone on hand. We'll describe how to sign up for the Wisconsin statewide standing order, outline the steps to implement the standing order in your pharmacy practice, and describe what and when to report to the Department of Health Services under the standing order. As we know, the opioid overdose epidemic is huge. The CDC has characterized the epidemic as just that. 78 Americans die every day from an opioid overdose. Just today, headlines reached my desk where small children are being impacted by parents overdosing. Just a tragic story, and we all really need to join together to attack this in a multi-pronged way. In 2014, Wisconsin lost at least 853 lives due to drug overdose deaths. 45% of those were prescription opioid overdose deaths, 28% heroin. This is not only an impact to loss of life, but also the epidemic impacts costs for healthcare and the stress on the healthcare system. Opioid overdose is classified as an acute condition where excess opioids have been taken. The mechanism in the body causes decreased sensitivity to changes in oxygen and CO2, basically causing respiratory depression. And that's how patients die through opioid overdose, is through depressed respiratory system. What you may not know is that opioid overdose death usually occurs over a period of 1 to 3 hours. So there is time for intervention, and where naloxone being at the site of an overdose can really impact the ability for us to save these patients' lives. Naloxone is a safe and effective antidote to reverse opioid overdose. It has a high affinity for opioid receptors so that it competes with the opioid that has been taken at those receptors, and works usually within 30 to 90 minutes. It's been found to be very safe. If it's administered in the absence of narcotics, it essentially exhibits no pharmacologic effect. Therefore, those in the healthcare community feel that it's very beneficial to have this widely available and very safe for the general population to have access to. Naloxone is an antidote for opioids. It's an antidote for the opioids listed here, both synthetic and prescription, and drugs of abuse as well. So naloxone works to reverse the respiratory depression and the hypotension that occurs in an overdose situation. It allows the patient to hopefully restore their breathing, and it also reverses any analgesia effects and can cause withdrawal symptoms after naloxone is administered. So patients that have received naloxone will describe feeling all of the effects of withdrawal. They may feel compelled to use again as well. So it's critical that these patients are seen emergently, that 911 should be used, and the healthcare system should be activated for these patients. Naloxone takes effect usually within 3 to 5 minutes. It can even be quicker. We all have heard stories of first responders that administer naloxone and patients are back up and breathing fairly quickly. If a patient is not responsive, a second dose can be administered. And all of the naloxone kits that are provided under the statewide standing order need to have 2 doses for this reason. Naloxone does wear off in 60 to 90 minutes, so patients can go back into overdose if long-acting opioids were taken. As I mentioned earlier, patients may want to use again because they'll feel withdrawal symptoms, like flu-like symptoms. They'll just feel really rotten. And so, again, critical for them to be put into the emergency response system. This is a key counseling point, that the shelf life of naloxone is about a year to 18 months. It needs to be stored at room temperature to minimize degradation. So just like one would need to refill an EpiPen or glucagon kit, naloxone needs to be refilled and replenished when it expires. So right now I'm going to review the Wisconsin statewide standing order for naloxone, the components of the standing order, as well as steps for implementation. All of the other clinical information regarding naloxone can be found in the training materials that are recommended by the Department of Health Services and are required for participation in the statewide standing order. So Wisconsin has passed or enacted 2 different pieces of legislation that make having a statewide standing order possible. There are several pieces of the Pharmacy Practice Act that relate directly to opioid antagonists or naloxone and implementation of a standing order. As a result of these pieces of legislation being enacted, we're pleased to tell you that on August 27th at the PSW annual meeting, the naloxone statewide standing order was signed by Dr. Jonathan Myman, a chief medical officer with the Department of Health Services. That was signed in the presence of Governor Scott Walker and covered by many local and state level media, as well as some national media as well. The standing order allows a physician to delegate authority to pharmacists that are practicing and licensed in Wisconsin to dispense the naloxone medication, in this case, without a prescription to patients based upon a predetermined set of conditions and criteria. In this case, individuals at risk for an opioid overdose, as well as individuals in a position to assist a patient at risk for an overdose, are eligible to receive naloxone. The statewide standing order is intended in cases where pharmacies do not have their own medical provider to issue a prescription order or standing order for naloxone. Some organizations have standing orders or naloxone protocols in place outside of the statewide standing order, and we applaud their work in that effort. The statewide standing order is designed to expand access to naloxone provision, streamlining the process for organizations that may not have their own medical provider. The statewide standing order must be renewed annually through the Department of Health Services website. So how do you sign up? Any pharmacy in Wisconsin can participate in dispensing naloxone through the standing order. The website through DHS that's listed on this slide walks through the steps of implementation and signing up through the statewide standing order. So pharmacists can go to this website and request a signed statewide standing order. So how do you do that? You're going to check the download box at the website link. So you'll go to that website on the previous slide, select download the statewide standing order, highlight that download the signed statewide naloxone standing order, and hit submit. You'll read through the agreement and check, yes, my pharmacy agrees to fulfill all of the requirements if the criteria are met. You'll then fill in some information about your pharmacy practice, including an MPI number, as well as a contact person. And by hitting submit, you'll be able to print out the signed naloxone standing order with Dr. Jonathan Myman's signature on it. Then the managing pharmacist at your pharmacy must sign the standing order, and the signed copy of that standing order must be maintained on the premise at the pharmacy. Participating pharmacists through the statewide standing order are required to complete a 1-hour training. PSW is currently recommending the training program from the University of Rhode Island College of Pharmacy that's accessible through the DHS website. This program is widely used by multiple national organizations, and this slide walks through the steps on how to access that particular training. It's called OPIOIDS, Addiction, Overdose Prevention, Naloxone, and Patient Education. It will take you approximately 1 hour to complete. You'll go to the website, log in or register as a new user. You'll click on the View Available Home Studies link, then click on the program. You'll go through the training material by viewing the program slides with audio, and you do not need to complete the post-test unless you want to claim credit. There is a cost through University of Rhode Island College of Pharmacy to claim credit. So you do not need to do that. You may, but you do not need to. By signing the standing order, the managing pharmacist is attesting that all registered pharmacists at the site have completed the required training and are familiar with naloxone rescue kits and the patient education material. No further documentation of training is needed. So we're going to talk about which patients may benefit from having naloxone on hand. This is an example of a poster that DHS has developed that you can print off and hang within your pharmacy, or develop other similar material that may highlight the fact that your pharmacy is offering naloxone. So which populations should receive naloxone? Patients with the following risk factors listed on this slide: taking a prescription narcotic pain reliever for more than 3 months, taking methadone or buprenorphine for treatment of opioid use disorder, having previously experienced a non-fatal opioid overdose, having a history of non-medical opioid use, or taking a higher dose greater than 90 milligrams morphine equivalent per day. That risk factor is often called co-prescribing, where just like a patient on insulin might be co-prescribed a glucagon kit, patients on higher doses of opioids, greater than, in this case, greater than 90 milligrams morphine equivalent per day, may be co-prescribed naloxone. The items highlighted in red on this slide may be risk factors for having naloxone on hand. However, they aren't specifically outlined in the statewide standing order. They are listed in other resources, so we've included them on this slide for completeness. So additional risk factors for patients that should receive naloxone include those that may be rotating from one opioid to another, and in that case there may be possible incomplete cross-tolerance. Patients are at risk for overdose in those situations. Smoking, COPD, emphysema, asthma, sleep apnea, respiratory infection, or other respiratory illness may cause issues with a patient's breathing and may put them at risk for respiratory depression. Renal dysfunction, hepatic disease, cardiac illness, HIV/AIDS are also other risk factors. Known or suspected concurrent alcohol use can put patients at risk for overdose. Concurrent prescription of benzodiazepines or SSRIs or tricyclic antidepressants, as well as patients who have difficulty accessing EMS services due to distance or remoteness. All of these populations would be eligible to receive naloxone. So in addition to patients at risk for opioid overdose themselves, those in a position to help individuals at risk are also eligible to receive naloxone under the statewide standing order. Those could include family members, friends, or others that have contact with a person at risk for opioid-related overdose. Possible recipients of naloxone should have no contraindication, sensitivity, or allergy to naloxone. If a contraindication exists, the standing order outlines that a patient should be referred. Pharmacists should only dispense naloxone to patients that are oriented to person, place, and time and are able to understand and learn the essential components of an overdose response and naloxone administration. There is definitely some patient education that needs to accompany naloxone dispensing, and patients need to be able to understand those instructions. PSW recommends that pharmacies develop a screening program to help identify patients or other recipients that may benefit from having naloxone on hand. Pharmacy technicians can be used to engage patients in a discussion about naloxone use. The screening checklist and red flags brochure that are on this slide are available for download through the DHS website and highlight for patients, in the case of the red flags brochure, those that may benefit from having naloxone on hand. The screening checklist could be used by a pharmacy technician or provided to a patient. So you've determined that someone would benefit from having naloxone on hand. Now it's time to determine product selection. PSW would recommend that pharmacies determine which naloxone products or product they plan to have on hand for patients that would like to pick up naloxone, and to determine that as you implement the standing order. The standing order outlines that a specific naloxone formulation should be selected from its list of options in accordance with the recipient's preference and training, as well as in accordance with availability at the pharmacy and insurance coverage. We're going to review the 4 different options that are available for dispensing under the statewide standing order: intramuscular, intranasal, both the ready to use and assembly required, as well as auto-injectors. Certainly your pharmacy will want to be aware of reimbursement factors. PSW has developed an FAQ document that's linked on our website that provides more information about reimbursement questions. The first option for dispensing under the statewide standing order is intramuscular naloxone. A kit for intramuscular naloxone should include 2 single-use 1 ml vials of naloxone hydrochloride, 2 intramuscular needle syringes, the 3 ml 25 gauge 1-inch syringes, syringes and needles, as well as a set of gloves. And that's what is outlined as a standard intramuscular naloxone kit under the standing order. The intranasal kit, which requires assembly, should include 2 2 ml luer lock syringes pre-filled with naloxone, 2 mucosal atomization devices, and what's recommended in the standing order is the Teleflex MAD 300. The ready-to-use intranasal kit includes 2 prepackaged 2 single-use spray devices containing naloxone, and this would be likely ordered as Narcan nasal spray. This is the product that Medicaid currently covers. Auto-injectors, as we all know, are extremely expensive, but are available to dispense under the standing order when insurance coverage may be available. The auto-injector kit should include naloxone prepackaged in the kits containing 2 auto-injectors. These auto-injectors have audio instructions, and the kit also contains 1 training device. If an auto-injector is being dispensed, the pharmacist should pull out the training device and demonstrate its use for the patient at the point of dispensing. DHS has developed a checklist to use when assembling your naloxone kit. As I said earlier, your pharmacy may wish to determine which of these kits or which kit you plan to have on hand for dispensing. You'll notice that not only are the products and supplies listed here, but as well, the patient education materials are also listed. So how do you label the kit at the point of dispensing? All of the required medication information on a typical prescription label must be included. In addition, you should include the recipient of the kit. So we know that naloxone would be provided to patients that, or to individuals that may not be the recipient themselves. They may not be the one having the naloxone injected in them, maybe for a loved one. So you add to the label the name of the individual receiving the naloxone. So if Mrs. Jones comes in to pick it up for her son because she's concerned about her son overdosing, you would include Mrs. Jones' name on the label. The prescriber in this case is Dr. Jonathan Myman, as he is the signer of the statewide standing order. You'll include, just as you would on any prescription label, the naloxone formulation and concentration and the date dispensed. For refills, the statewide standing order allows you to indicate PRN refills for 1 year. The SIG is specified in the statewide standing order and should read, dispensed per standing order, use as directed, trained opioid responder. So for patient education, the statewide standing order outlines the items that you need to cover as a pharmacist, either with patient education verbally or with handouts, and preferably with both. You'll cover risk factors for overdose as well as prevention, how to recognize an overdose, how to respond to an overdose, including activating the emergency response system and administering naloxone, medication or supply disposal when naloxone is administered, how physician communication should be done, when it should be done, treatment referral, and as well as resources for those without medication coverage through insurance. Your counseling should also include when to refill the medication, when it expires, and as I mentioned earlier, typically naloxone expires within 12 to 18 months. So DHS has developed a number of resources, including some of the ones I've highlighted already, and 3 handouts for patients that should be included in all naloxone kits. The first is the Opioid Safety and Overdose Prevention Brochure. This brochure highlights information for patients and caregivers regarding risks for overdose, how to recognize an overdose, and additional information. The website for accessing this form is available on this slide and can be directly linked to through the statewide standing order website. The first panel of the brochure, What is Naloxone?, describes what naloxone is, how it could be used, how it should be stored, and that it has an expiration date and a refill may be needed. The second panel of the brochure includes risk factors for overdose and how to prevent an overdose. These could be highlighted by a pharmacist that's dispensing naloxone. The final panel, the back side, Recognizing an Overdose, walks the recipient through signs and symptoms of an opioid overdose when naloxone may be needed. 911 is highlighted as an important point on this panel so that patients know, or recipients know, that 911 should be activated. The second resource that DHS has developed for inclusion in a naloxone kit is the Patient Resource Guide. The link for this guide is available on this slide as well as through the DHS Standing Order website. This is a very simple handout that can be provided in the naloxone kit that covers the safe disposal of medications and sharps, where to go if naloxone is too expensive for the individual, and where to go for information about treatment options. Providing naloxone is certainly designed to lengthen the time that we have to get patients into treatment. You can't treat somebody that's not alive. So naloxone is designed to be a rescue and then providing the opportunity for patients to get access to treatment options. The final handout that should be included in every naloxone kit is the handout on administering naloxone and responding to an overdose. The link for this handout is available on the slide as well as through the DHS Standing Order website. This first panel highlights how to give naloxone and includes the 4 different mechanisms of naloxone provision that are highlighted in the statewide standing order. Your patient will be receiving one of these types of naloxone. So we would strongly recommend that you perhaps highlight or circle in red or with a Sharpie or something to indicate which type of naloxone they're receiving and walk them through each of the steps when available using a training device. This is the reverse of that same handout, highlights how to respond in an overdose situation. The handout is designed to be easy to read and walks them through the 6 steps for responding to an overdose, including identifying the overdose, calling 911, providing rescue breaths, giving naloxone, putting the patient in the recovery position, and staying until help arrives. This handout should be kept with the naloxone kit so that in the event that naloxone needs to be administered, the person doing the administration has this readily available. As you can imagine, some of the types of naloxone may be easier to administer in an emergency situation, but if you have a patient who's not medically trained, trying to draw up naloxone and administer it through injection in an emergency situation, there may be a lot of discomfort. So training is really key in this case, reviewing the steps and keeping this handout handy. This slide highlights additional patient counseling pearls that you may want to think about as you talk with patients about naloxone. You'll want to determine if the medication is for the recipient that you're handing it to or intended for use on someone else. If the individual that's picking up the naloxone is the intended potential recipient of the naloxone, meaning that they are at risk for an overdose themselves, you'll want to talk with them about educating those around them about naloxone use. It's not going to work if the person that's overdosing is the one trained to administer naloxone. So just like EpiPens or glucagon kits they'll need to provide training to other individuals that are close to them that may be with them in the event of a possible overdose. If the naloxone is intended to be used on someone else, you'll want to know that for insurance billing purposes. Using the FAQ guide, you'll be able to determine how to bill for naloxone in those situations. Additionally, you'll want to determine if the individual has administered naloxone before. If somebody has administered naloxone before or gone through other training, they may need less information from you as the pharmacist. But in most cases, you're going to be encountering patients that have little to no familiarity with naloxone. We would strongly recommend walking through each of the patient handouts, highlighting critical information on those 3 handouts that are created by DHS. In particular, you'll want to highlight that naloxone may take 3 to 5 minutes for effect and that withdrawal symptoms are normal. You'll want to highlight that a second dose may be administered if a patient is not responding after the first dose. You'll also want to highlight that naloxone does wear off. These individuals need to get access to EMS, be admitted to a hospital potentially for close monitoring. Patients can go back into overdose after that 30 to 90-minute period. Because these individuals may be experiencing withdrawal symptoms, they may want to take more opioids during the time after naloxone is administered because they're feeling these withdrawal symptoms. Again, this is particularly important that these patients get access to emergency medical care. 911 is critical. PrescribeToPrevent.org is a wonderful resource. DHS recommends having this website available for patients in your pharmacy when possible. You certainly may want to review the material available on PrescribeToPrevent.org. So now that you've determined you're participating in the statewide standing order, you've determined what naloxone you'll carry, how you'll label it, which materials you'll provide to patients, and how you'll talk to patients about naloxone. You're going to need to set up a plan for reporting. Reporting requirements are outlined in the statewide standing order. You'll maintain your prescription records just as you would for any other prescription, but you'll also need to report all naloxone dispensed through the statewide standing order on a quarterly basis to DHS. Dr. Myman's prescriber number is listed on this slide, so this can help you determine which naloxone was dispensed under the statewide standing order. Quarterly reporting is required on the schedule outlined here. This can also be found on the DHS website. To submit your quarterly report, you'll go to the DHS standing order website, click on the link to submit a report. This is through a program called REDCap. You'll check enter quarterly naloxone data for my pharmacy. Here you'll fill in your pharmacy information, your contact information, just as you did when you were signing up for the standing order. You'll then check the quarter for which you are reporting and fill out the information. Information that will need to be submitted includes the total number of naloxone doses dispensed under the standing order, so under Dr. Myman's prescriber number, the total number of naloxone dispensed under the standing order, the total number of naloxone dispensed that were refills, and the number of dosage forms dispensed. And they also are asking for you to provide challenges or barriers to dispensing naloxone. Additional resources are available on the PSW website, including the FAQ document that I referenced earlier. We will also be posting administration videos, a link to Prescribe to Prevent, and the Wisconsin Naloxone Standing Order DHS webpage, which I referred to frequently during this presentation, is a wonderful resource that will provide contemporary links to all of the information that you need for standing order implementation. Thank you for listening to this webinar. We hope that you find this is an important public health initiative to invest in and engage in. We encourage you to contact our office with questions as you encounter them. We'll be continually updating the FAQ